If you aren't getting the care and support you need from your doctor, parting ways could be the healthiest choice for you. It is vital to have a strong care team to help you along your journey to recover your health and maintain your health. While switching providers isn't the easiest, it may be necessary for you to get the care you need. Here are a few things to consider when thinking about breaking up with your provider. You don't click. Odds are you won't see eye to eye on everything with your provider, but it is important that you work well together. Some providers who are forward, direct, and blunt, others can be a warm bedside manner. When you are mismatched and your communication styles are different, it could be time to look for a new provider who will better fit your needs. Bad timing. Do you frequently have to wait a long time to see your provider? Do you feel like they are rushing through your appointment? You should never feel rushed. Even if you don't get the answer you were looking for, you should never feel rushed. You should always feel like you had time to ask everything you wanted. If your doctor isn't taking time to answer your questions, all of your questions, that is not okay. It's time to find someone who will take the time and listen to answer your questions. Lack of understanding. Whether your doctor uses too much medical jargon that you don't understand, or you don't understand why a certain test or treatment is needed, they are not doing their job. Your health is too important to feel uninformed. It's your responsibility to take the necessary follow-up questions to make sure you completely understand, but your provider should be open and thorough so you understand the course of action. Poor listening. Communication is vital to a good patient-provider relationship. You need to feel like your provider is listening and hearing you. If you feel like you are asking questions and they're not being answered, then you may want to look elsewhere. It's important for your provider to hear your health history. Go to the doctor who quits typing on the keyboard and looks you in the eye and listens. You don't feel comfortable. Sometimes providers need to know more about you than you share with anyone. It's important that you feel comfortable sharing. It's a simple feeling of unease. This is enough of a reason to start their search for a new doctor. They may not work well with others. Your primary care doctor should be the coordinator of your healthcare team. They should help you manage each step of the process, whether it be a medical procedure or your experience and your effectiveness at the massage therapist. They should keep track of reports, records, instructions from other providers, and recommendations for your health. If they aren't on top of this, part of your care could slip through the cracks. Availability. It is important for you to be able to follow up with your doctor on any questions or concerns you might have. Are they available during off hours if need be? Do you know what to do in an emergency situation? Make sure your provider can be available when and where you might need them, or at least have the discussion with them so that you know what to do if there is an emergency. Lack of learning. Regardless if your doctor went to a school a few years ago or a few decades ago, it's important for him or her to stay up to date on the latest medical tools and research. Medicine has changed significantly over the years due to science, technology, and research. And it's important that you're getting the best, most accurate information. Your providers should have info for you either at the front desk, at the office staff, or to be able to give you a couple of sentences about what they're reading and looking into. If that information is not available, or they're not willing to communicate that with you, that could be a red flag. Bad reviews. Always look up reviews on your providers. These should be relatively easy to find online, on the website, or social media. This will give you valuable information from other patients who have experiences with your provider. If there are multiple negative reviews, you may want to consider seeing somebody else. If even one of these factors seems off with your provider, it is certainly okay to start looking for a new one. Just because you aren't a good match doesn't mean he or she isn't a good person. You deserve the best, and only you know what you are comfortable with and what is best for you.